I'm going to present is a skin pathology case. So as you can see, this is an H&E slide of a skin fragment showing an epidermis, a dermis, and a big blister or bulla cavity. This blister and bulla cavity looks to be in the subepidermal location because the whole of the epidermis makes the roof, and the floor is on this level shows a bit of necrotic infiltrative look. The cavity is mainly composed of some fibrin and infiltrate on low power. Oh, there is vessels showing perivascular inflammatory infiltrate. The high power view of the floor shows the dermal papillae, which are obscured by inflammatory infiltrate, mostly acute, mostly by neutrophils, some eosinophils also scattered, and also shows a little bit of necrosis. So there's no signs of epidermis, which shows that this blister is definitely subepidermal in location. Characteristic neutrophilic collections. So going on to the sides showing the normal skin and the dermis showing perivascular inflammatory infiltrate, which has eos. So this is a case of Dermatitis Herpetiformis. Dermatitis Herpetiformis is a case. It is a autoimmune blistering condition which is associated with gluten sensitive enteropathy, also known as celiac disease. So clinically, the patient presents with very itchy papules and vesicles, mostly pinpoint in appearance, and the location is mainly the extensor surfaces like the buttocks, the elbows, the knees, the backs, and the posterior neck. Patients are usually in their 20s to 40s, and this disease is more common in males. Is symmetrically distributed, as you can see with some of the clinical pictures. This condition is diagnosed based on histopathology, immunofluorescence, ELISA. So for histopathology, the characteristic picture is of a subepidermal blister or vesicle showing papillary neutrophilic microabscesses, and these microabscesses can also have some eosinophils. And also the dermis having superficial perivascular inflammatory infiltrate, which can also have neutrophils, and sometimes in the early lesions, that is the only histopathological finding you can get if there's no bulla, and that can also be confused by vasculitis. These are some internet pictures of Dermatitis Herpetiformis. For immunofluorescence, direct immunofluorescence shows granular or fibrillary IgA deposition along the base membrane and also in the dermal papillae. Sometimes granular C3 deposition can also be seen. Dermatitis herpetiformis is an autoimmune disease. It is an acquired autoimmune disease. The autoimmune disease is because of autoantibodies being formed against transglutaminase. This transglutaminase, especially the epidermal type, is located around the dermal papillae. That is why that is a characteristic finding. And since Dermatitis herpetiformis is associated with celiac disease, the celiac disease is the one that gives origin to these IgA antibodies that also involve the skin. Patients, after having the skin biopsy and blood work, get the treatment of gluten-free diet, which helps, symptomatic treatment for pruritus, and then a dapsone. More pathology updates. Thank you.